for tuning in to another Dynamic Joint podcast episode. Forgive me. Forgive me. But we're going to keep rolling. I am your one and only Dr. Tyre, your physical therapist, and this is my Robin.
No.
What? Okay. Louise.
What?
Who was Barney's sister?
What I'm not going to do.
Who is Barney's sister?
It's Baby Bob, and I.
You are Baby Bob.
I don't have time for this.
Baby Bob.
I am Dr. Angie. I am the occupational and physical therapist on this dynamic team right here, right now. We are inside of our clinic, Dynamic Duo PT here in West Palm Beach, Florida, where we're ready to serve you guys.
Yeah. So if you want to feel good
from head to toe,
you better call the Dynamic Duo.
What?
All right. All right. So today's episode is.
It's a little touchy. I may offend some people.
But
we don't mean it that way.
Right. Listen to our hearts. We're not here to offend anyone. We're here to educate and inform.
Yes.
And today's episode is doctors
don't always know.
No, they don't. They don't always know. And what do we mean by that, right? We mean that you spend minute time, whether it's 10, 15, upwards to 30 minutes with your doctor, and they may or may not listen to you because they are overwhelmed or swamped with their own patient caseload.
Right.
And so what they're trying to do is give you a quick fix and move you on your merry way. Physical and occupational therapists, we spend an hour with you. Sometimes we spend upwards to an hour and a half with you, depending on how severe your case is and how much
fun we're having.
Right. And so we can pick up on things that your doctor may have missed because we spent more time with you.
Right. So let's start that process of how they actually come to us.
Okay,
right?
Let them know.
You get a referral from your doctor. The doctor writes what he thinks is your diagnosis. You bring that to us. He also
he or she.
Right. Because girl power.
Because we rule and boys drool. Okay, I'm sorry. Go ahead.
Okay. She didn't mean that boys, young men that are watching us.
Professional men.
Right.
Or non-professional. Whomever.
Right.
Okay.
Back to the story.
Yeah.
So you get your referral. On it, it has a diagnosis, and it usually has what they would like the therapist to, how many times they would like to see you.
Mm-hmm.
Sometimes it's 3 times a week for 4 weeks, right? Sometimes it's 6 times a week for 19 weeks. It's random. And it's not always appropriate.
It's not.
Right? If I just have a simple big toe injury, right? There's no need for me to see you 3 times a week for 16 weeks.
Right.
It's not. I think a lot of times people get hung up. Well, the doctor told me this is what I'm going to have to do, and this is what I'm going to see. Well, remember on the previous episode, we talked about copays. Imagine you having to pay a $65 copay each time you went. Mm-hmm. That adds up quickly, 3 times in a week.
And not only that, this is our specialty. This is our career. This is someone that's blowing, but we going to keep it moving and going it on. But this is our career, right? And so we know what would be best for you when you come through our doors and we do an extensive evaluation. Right? Because what the doctor wrote on the referral is just a suggestion. That's not an end all be all, because at the end of the day, we make the final decision on how long you should come to see us. And then how long do we think it'll take for you to get better? And then on top of that, what it says on the referral, for an example, if they say massage, because that gets us. That gets us.
I have gone for way too long.
That gets us. So massage and E-stim. And the patient may say, well, the doctor said all I need is massage and E-stim. And what do we say?
I don't do massage. Mm-hmm. You should go to Massage Envy. Mm-hmm. Shout out to Massage Envy. All they do.
Or a massage therapist.
Right.
Because that's what they do. That's what they've been trained for, right?
Right.
So again, what you have on what the doctors write on the script doesn't always necessarily mean that is what we're going to do in the clinic. Now, there are some exceptions to the rule because if you're coming from surgery, then yes, there is a protocol that we have to follow from the doctor, from the surgeon. And because that is for your benefit and for your good, and we don't want to do anything that's going to cause harm to you, right? And we want you to make sure that you're able to progress accordingly. So yes, when those incidents happen, then yes, we do follow those protocols. We follow the doctor's orders in regards to that.
Right. I think sometimes people also think that what the doctor said is right.
Oh, it's golden rule.
Right. We get diagnoses for people having low back pain, but it's actually their hips that are causing the issue, right? I think they also don't understand that sometimes the doctor is just trying to get them out of the door. And no disrespect, they are overworked, and right now there's actually a shortage of medical doctors. So they're only doing the best that they can. And sometimes their thought process are just stuck in general areas of, well, I've already had 4 people that have back pain. Let me just write that down. Sometimes they didn't even talk to the client, and they're just assuming from what the person filled out on the intake paperwork, that's what it is. So
you're speaking from experience in that regard.
Absolutely. So for my knee, we talked about
personal experience.
We talked about that in another episode where the doctor didn't even speak to me, and the first thing that came out of his mouth was, "I'm going to inject your knee, and that'll take your pain away." But where he anticipated my pain was, it was not even there. And then after we discovered where my pain was actually coming from, my quad tendon, that the injection wouldn't even help it. So had I just accepted it, it would have meant nothing. And I still would have been in the same amount of discomfort, not being able to do things that I need to do, because y'all don't know, I'm a true athlete. Thank you.
Here we go.
So just being mindful that you want people that listen to you and ask pertinent questions so that we can figure out what the issue is, which then tells you the whole picture of why you're in that much pain.
And if we ask you the right questions, then that will in turn let us know if there's something else that's going on that requires further assessment from a specialty doctor, right? So that's where red flags come into play. We have had extensive education in being a physical and occupational therapist. So with that being said, we know what doesn't seem right. We know what may be abnormal. We know that, I think you may need to see a specialist because you're presenting as A, B, C, D, E, F, G, right? And so
You want to go through the whole alphabet?
I was.
People say ABC.
All right, but I'm not most people. I'm our friend's physical therapist, the one and only.
Okay.
World renowned.
Yeah.
Right. So if I want to say A, B, C, D, E, F, G, I can.
You say world renowned. What you really mean is West Coast renowned.
World renowned. Speaking it into existence.
Right.
But like, for an example, going back to what I was talking about, spending time with our patients, sometimes we spend over an hour, and in that time frame, we may pick up on things that seems abnormal. So my story is, I had a patient, she came here she had a referral for back pain. And the reason why she had back pain was because she had inflammation of the spine. So that was the diagnosis. She was presenting other than having back pain and inflammation of the spine. She was actually presenting as if she was having some form of a neurological disorder. And if I did not push the fact to the doctor, like, I feel like something else is going on, I feel like it's more than just inflammation of the spine that's causing this patient to walk different, to cause this patient to not speak clearly or speak low, that's causing this patient to be more prone of falls, then she will still be coming to therapy for back pain. And then that goes back into what we talked about our previous episode, and being in a manufactured physical therapy or occupational therapy clinic where we having to work with 2 or 3 different kind of patients at the same time,
right,
and not understanding like, hey, something else is going on with this client. That could have been missed at that particular clinic versus coming to see us, right? And so pushing that fact of she needs to see a different specialist, a neurologist, because then that's going to help figure out why she's moving the way she's moving and things of that nature. And at the end of the day, she thanked me. And not only that, the doctor that referred her to us also thanked me, because going above and beyond for our patients is what we do here at Dynamic Duo PT in West Palm Beach.
I like that.
Florida. Yeah.
It's true, because we have a lot of clients that come in with these simple referrals of back pain or arthritis and not realizing sometimes it's a little bit more than that.
Yep.
And my story is the flip. We were at a corporate presentation. We were talking to a group of bankers and we were telling them about posture and being mindful of your body and
every time.
Posture. Right?
Because I like to just lean on against the lean.
But you can't tell the people.
What? You're right.
You can't tell the people to do it and then
you're right. I have to practice what I preach. Okay.
Right.
Posture.
Back to professional.
Okay, got it.
So we're giving this talk about arthritis and things to do, and she comes up to talk to me after the fact. And she's like, I asked my doctor if I should do therapy, and he was like, nothing is going to happen. You just have arthritis in your hands. You're getting older. That's the way it's going to be. Talking to me, is there anything absolutely. Therapy can help everybody.
Yes.
Right? If it's not just a physical component, it's a mental component. In our clinic, it's definitely about social. Like we've created a community where we just laugh and have fun.
Yep.
And everybody gets picked on and everybody is a target, right?
Yep.
No
Big
matter
hands.
Let's not do that.
Y'all see it? Raise it up so they can see. Raise it up.
So just being mindful of that. Of course, my answer is yes, come see me. Let's see what we can do. She was upset because the doctor gave her a medicine that would take away the discomfort in her hands, but it also caused her to be anemic. So a lady that had no pain medication, no medical needing any medication, period, was now taking an arthritic medication that took away the pain. But because she became anemic, now she had to take another pill on top of that. So going from nothing to now having to take 2 pills and supplements, which we kind of need, but her having to do that it was disheartening to her because she just saw that her youth was fading away from her. So she comes in here, we work with her for about 2 weeks, ask her, heck, how was your weekend? She's like, oh, well, I regrounded my whole bathroom. Wait a minute. Wait, what do you mean? She was like, I had no pain. I could move my hands the way I need to. I really dislike that the doctor never told me that I should go to therapy because you have made a world of difference in these 2 weeks than the whole time I was on that medication and then feeling the side effects of what that medication that gave me. So for us being therapists, our job is to meet people in the community so that they know that sometimes doctors don't know exactly what we do. And if I were to describe occupational therapy now, it would be different based on who I was talking to because we can do so much. And I think that's hard for people to understand and grasp the concept.
And I like your story because I do remember your patient and she's a grandmother.
Yeah.
And her primary goal was not to grout her bathroom.
Right.
But was to be able to hold her babies. And could you imagine her grandchildren? And could you imagine a doctor saying, well, I don't know what else to do with your hands, just deal with it.
Right.
And you can't do the simple fact of holding your grandbaby, something that's so precious and dear to you. So again, not to bash doctors. This isn't a bashing episode. This is just letting you guys know that physical and occupational therapists can also help you recover from whatever issues that you are experiencing, and also working closely with your doctor. So if there are red flags that come up, or if there is something that needs further medical attention or assessment, then we can be your advocate, right?
Because we're the detectives of the musculoskeletal system.
What does that mean? Because you love to tell people that.
I do love to tell people because it's true. Remember, I would be a detective if I weren't a lunch lady. But
we have to talk about this lunch lady.
Well, that's not important right now. What I'm saying is that when people come in to work with me, don't tell me what the doctor said. Mm-hmm. Don't tell me what your MRI said. Don't tell me what your X-ray said. Tell me what you feel. Mm-hmm. Let me examine you. Let me go through my assessments. Let me put this puzzle together, and let's figure out the real root cause of this, right? We talked about referred pain in other areas that may be causing discomfort, but it's not the actual cause of the discomfort. And that's my job, is to find it. So I consider myself a detective of the musculoskeletal system, Dr. Tyre.
Okay.
Because I like to detect The musculoskeletal system.
And remember, going back to our other episode, she doesn't like to listen.
I don't.
Okay. And so she wants to figure it out, which is a good thing. That's a good quality to have as a therapist because they're going to figure it out. They're going to make sure, okay, what's happening, like she said, putting the puzzle pieces together just to create this whole picture. One, because then that better serves you. And it also helps you get better and feel better. And like I always say, move better, right?
I'm like the good doctor, right?
I wouldn't go that far.
No.
You want me to listen to what you're about to say?
Yes,
because I was closing my eyes and I was turning my head to the opposite
that makes you
direction.
going to sleep.
I was.
I'm gonna tell the 5 people out there. So I'm like the good doctor.
Okay.
I have all these thoughts floating in my head when somebody walks in. And I'm like not grabbing at the ones that it could be, but I'm throwing to the ones that it's not, right? If somebody come in with a general diagnosis of like patellofemoral syndrome,
And what does that mean?
knee pain, right?
Yep.
It's no real reason why. My job is to figure out the reason why. So is it really the hip or the ankle? Is it the quads that's pulling on? Is it the patella tendon? Like my mind is just boom, 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 boom. And I'm narrowing everything down. See? Like the good doctor. And so...
When was the last time you watched an episode of The Good Doctor?
I don't know. It's probably the first season.
Right. Go ahead.
But you make me work so much. I don't have time to watch The Good Doctor. Hire me, good doctor. I
No.
could be your sidekick.
No. Don't hire her because she has a business to run. Okay?
It's true.
Okay.
It's true. But that's the type of mentality I have.
Mhm.
I don't want to be biased by something.
Yep.
I like to figure it out so that when I go to the doctor, I can say, well, based on my assessment, based on what I found, I think it's more of this or those red flags, like your lady, because I remember it's like she's not picking up her feet.
Right.
She can't slow herself down when she's walking.
Right.
There's all these things that just don't add up with quote unquote
Back pain.
back pain due to inflammation of the spine.
Right.
I have never gotten a diagnosis of inflammation of the spine.
That will cause these
Symptoms.
things to happen.
Right. So just being mindful that although the doctor is sending you to therapy for a reason, it may not be that actual reason.
Absolutely. And then we also talked a little bit about direct access and how important that is. How important it is for you to be your own advocate. How
Yes.
important it is to take health into your own hands because you are you. You are with you 24/7. So if you don't feel better, if you aren't feeling like your normal self, then yes, you should go ahead and seek out medical attention, right?
Right.
If you're in the West Palm Beach area, you should seek us out.
Right. Now, don't get me wrong. There are a lot of good therapists out here, but we're some of the best.
Yeah, we are. Right? And we
That's
are too.
not-
And it's okay to toot your own
Oh, I was
horn.
going to say, and we're not too.
Oh,
we are too.
I'm okay with tooting our own horn or giving ourselves a pat on the back.
Right.
Because I mean we've worked hard to be in this position,
Right.
and we have the student loans that we talked about in the previous episode of us being in this
Yeah, we
position.
did tell those nice
Mhm.
folks out there. But I think people often forget that because of direct access, if you ever experience some kind of discomfort, come see us. During the pandemic, we were part of that first line of defense
Mhm.
because if we could clear the ER from the COVID, like the people that are having respiratory or COVID issues and bring back pain and leg pain and I fell and I hurt my back,
Mhm.
like those type of people into the clinic, it allows somebody who needs real help or more extensive help to
Mhm.
get it without you having to wait too long.
Absolutely.
So I think that we deserve more, not only from health insurance, but from on the continuum of healthcare, we're all equal.
Absolutely. And I think I can only speak for us. We like to have a sense of cohesiveness when it comes to caring for our patients. That means that we want to know who your doctors are.
Absolutely.
Whether it's your primary care doctor, your heart doctor, your lung doctor, cancer doctor, whatever it is, because we want them to understand, okay, this is what we're doing here in therapy. This is how you're presenting. These are the things that we're looking out for. Is there anything else that we need to be, watchful for, right? Or again, those red flags. We keep talking about the red flags because we are the first line of defense. If there's something else that's not happening or is happening that should not be happening, then we know how to direct our concerns to where or who to talk to about your concerns and your presentation.
Right.
So I think it's good to have a network of your healthcare providers working together. So like I said, medical doctors, your physical, occupational, and your speech therapist,
Right.
your mental health counselor, your social worker, like everybody, because then that helps you get better. That helps you with resources of the community that you may need in order to be independent. That's where OT comes in, and as well as the social worker to come in and work hand in hand to help you be able to navigate your home or be able to navigate your community in a safer manner, right?
I think that sometimes people often think that, well, we're physical therapists, we don't meet up to the qualifications of other health professionals, and that's not true.
Mm-hmm.
Our skill set is definitely needed just like everyone else's, and we all serve a purpose in this realm of healthcare and being on a medical team, which kind of goes into not just the therapy aspects or the doctor aspects, but even your personal trainer, right?
Right.
You come to see us and we're identifying these areas of, listen, you have really weak glutes, your hamstrings are good, your body mechanics are horrible. Like, have your personal trainer work on this. You know what? Give them my phone number. I'll talk to them and give them the info on that. And we've had not only personal trainers, but the tennis coach that we have for that young lady. He reached out to us to talk to us. How can we make her the best star that we can make her with her current injuries? How can we prevent these injuries from happening again? What do we need to focus on a little bit more? I have no problem talking to people and listening to them. Even though Tyre said I don't listen to you.
No, she just doesn't listen to me.
That's true. But everybody else,
So y'all keep her in your prayers, please.
I'm listening. I'm just not taking what she says in. Everybody else goes in and it stays in, like it's like barrier. But for her, it's like a river, it just flow on.
Because it's a hater. It's a hater.
We wouldn't go that far.
Okay. It's the yops.
Oh,
if you tuned into our previous episodes, you would know that little joke. So if you don't know, go back and look at them.
Right. But on the good note, it's our job is to be in a team. You want a good medical team. You want people that are willing to talk to each other. Nobody should be so busy that they can't make sure that your care is priority.
And not only busy, but feel like you're less than. So I don't need to communicate with you. Whatever you say is beneath me because I have the higher degree or the higher standard of degree according to society.
Right. And I think that kind of goes into our fun fact.
Fun fact. I just wanted to sing.
You keep doing this.
If Jesus gave me the ability to sing, let me tell you guys, I would be singing everything.
Did you say everything?
I did, because I wanted to say every little thing is going to be all right.
We do not own the rights to this music.
I love that song. That's my favorite song.
But we all serve a purpose in this health field.
Yeah.
Every discipline, every professional, whether it's the intake person, everybody has a purpose. And if we all work together, our healthcare can be as great as could be.
Thank you again for tuning in to another Dynamic Joint episode. Please make sure you like and subscribe and stay tuned for season 2. Ow!
Ba-da-ba-ba. Don't do it.
Oh, girl, you set me up for it. You can't set me up and then take me away from it.
Just so nice people. We appreciate you guys.
Yes.
And stick with us as we ride this roller coaster of healthcare into the future.
Absolutely.
All right.
We'll see you soon.
Bye.